On this episode of Candid Conversations, I'm sitting down with my brain bestie, the brilliant Dr. Alaina Davis, chair of the speech department at Howard University, certified brain injury specialist and trainer, public speaker, podcast host, and yes, a phenomenal baker too. She's a powerhouse in the field and somehow balances it all with grace, calm, and a whole lot of impact. Get ready to be inspired by one of the sharpest minds and kindest hearts in the speech profession. So without further ado, let's get candid.
Welcome to another episode of Candid Conversations with Dr. Kelly. I am very excited about our guest today. I have my sister in brain, in the brain space, Dr. Alaina Davis. She is phenomenal, knows all things brain. She is my go-to if I ever need anything, a question, and she is just a wealth of knowledge. So I'm so excited to have her here. Thank you so much for being on, Dr. Davis.
Well, thank you for inviting me, Dr. Kelly.
Of course, of course. I had to have you on. So I always like to have my guests start off by introducing themselves to our listeners. So please tell us who you are and a little about yourself.
Okay, so, well, as you mentioned, I'm Dr. Alaina Davis. I am originally from Texas, but right now living in the DMV, so the DC, Maryland area. I am a medical speech language pathologist and a associate professor and department chair at Howard University. Um, I also podcast and I am a baker.
A phenomenal baker. Ladies and gentlemen, if you ever have the opportunity to sample or try Lena's cakes, please do yourself a favor and do so. My my comment for them, aside from how delicious they are, is always how moist they are. Like, it doesn't matter if you open it that day or if you wait a couple days to savor it. It is always moist. So please make sure that you try her cakes. They are amazing.
Oh, thank you.
Yes. And all the other things, podcast. She too does a podcast, which I have been on. And
Mhm.
you said, I want to make sure that it's right. There are a lot of L's.
Yeah, it's the Life, Language, and Lyrics podcast.
Yes, yes. And fun fact, at the end when I do the candid questionnaire, that is inspiration from Dr. Davis. It's a combo because she has a fun part where she asks about lyrics and life, and she incorporates like the fun in her podcast. And so I wanted to have some fun in my podcast too. So that's part of
We all
the
need a little
inspiration.
fun.
Yeah, yeah, a little fun, break it up. Okay, so let's dive right into it. Because you are into the brain space as well, I
Mhm.
want to know what initially drew you to studying the brain.
Ooh, that's a good question. So, actually, I thought I was just going to work with children up until I got into my master's program. And when I got there, one of the very first classes that we took was a neuroscience class. And that's where my interest like really started to peak. And then I think maybe it was either that spring of the first year or the second fall of the second year, we had an aphasia class. And every time the instructor told us these interesting things about how the brain like supports the rest of the body, it just I was all in. I was all in. And then like once I got the opportunity to like work with different clients and stuff, I was sold. So that's really what pulled me into just the brain in general.
Okay, good story. Let the audience know, where did you get your master's from?
Oh, I went to Southern University and A&M College in Baton Rouge, Louisiana.
Wow, Southern girl.
Yes, Southern all the
Yeah.
way through.
Well, there's nothing wrong with that. Go ahead, Southern. I love you all's colors.
Yeah. Well, funny enough, those are also my sorority colors. So it
That is
worked well for
right.
me.
So no matter what, if you're wearing the colors, you could be repping for both.
Yep.
Dr. Davis is a proud member of Sigma Gamma Rho Sorority Incorporated,
Yes.
part of the
Yeah.
D9. Yes, she's my D9 sis. I'm a member of Delta Sigma Theta Sorority Incorporated. So we
Mhm.
have that in common as well, D9 life. Okay, so did your university, did your program have a lot of opportunities for you to, work in that space with adults and more medical?
Mhm. Not really at that time. I don't know what it might be like now. At that time, 'cause Baton Rouge is fairly small too. So there weren't many opportunities, but I did get to spend a semester at like a very, very small, it was like a small rehab type of center where it was like one hallway of a building. Um, and then there was like another nursing home that I think we had some opportunities for, but primarily it was schools.
Yes, so I have noticed still to this day, like the majority of placements and opportunities are in that pediatric or school-based
Mhm,
space. And so I found it very difficult to get into the medical space, or more specifically, like the brain space, because my draw was to traumatic brain injury. But you have that like one coveted position at the VA,
mhm.
and everybody wants that position. And plus the VA was a long drive. And I mean, the complications of getting into a clinic. And so I really had to wait until I graduated and got into the sniff space to see anything like cog heavy, cognitive heavy for those who are listening who aren't in the speechy field.
Yeah, it happens a lot, and a lot of it too is it's just finding a place, one that will take students. Because there can be liabilities, and I think hospitals are a lot more cautious of that. And then the other factor is, does this SLP have time to provide supervision? Because if you think about when we're in the medical setting, we are go, 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 go. And anytime I've ever had a student, my day went a lot longer. And so we really need more spaces where there's like teaching programs and teaching institutions where they are more likely to bring in a student. I think that would be a help in that area.
I think that's a brilliant idea. I mean, they have teaching hospitals for doctors. They should do the same thing for the
Mhm,
other professionals that are in that space. I did supervise a student when I was at a SNF, but it was like 100-bed facility. It was out in the country, slower paced. And so it was
mhm,
much easier to take the time with a student to show them the ropes. But I couldn't imagine doing it in like a hospital setting. Um,
mhm,
I think that would be much more challenging. And like you said, the liability piece of it, because they're not licensed, they don't have their C's. So yeah, I think that is a good solution. A good answer would be a teaching hospital, teaching programs.
mhm.
And I find that that universities that do have that connection with a hospital, they have more of a setup for that because they're like primed for accepting students because they have that relationship.
Yeah, yeah, and and at Howard, we're a little lucky, right? Because we're in a space where there's a lot of hospitals, there's a lot of medical settings, and so we actually have increased a lot of our medical sites over the past couple of years, and now it's like they're reaching out to us to say, "Hey, we'd like to take students," and so I think location can also play a role.
Absolutely, but also the program plays a role because you all
Hmm.
crank out some fantastic students.
We do, we do.
Yes, that's an honor to have hospitals reach out and want to work with your students. That's great.
Yeah.
All right, so I would also like to know what made you or what drew you into speech as a whole, the speech field.
Oh, okay. I love to tell this story. So when I first started college, I was like, I think I want to be a counselor, but I'm not really sure. Very indecisive, right? And so I think I needed to like claim a major by like the end of the first year or something like that. And I was so confused. And I was like, but I like kids, but I like language, I like psychology, I like science, but what I don't think I want to be a classroom teacher. And they were like, well, if you're going to be a counselor, you have to teach for a couple of years first. And if you want to make money, you got to go get a PhD. And I was like, I ain't getting no PhD.
Isn't that how it goes?
Never say what you're not gonna do, right? And so what ended up happening was so I was at the University of Houston. for undergrad. And in the Career Center, they had these career personality tests. And I took a career personality test, and the top three options were like, I think it was like nursing, speech language pathology, and maybe teaching or audiology were somewhere up there. Um, and so I was like, well, let me look into this speech language pathology because one of my friends was in the major, but I never really knew what it was because she knew sign language and all she kept saying was, well, I know sign language. So I'm going to work with people who use sign language. And I was like, okay. So I think the next fall, I took like three classes, like all the intro classes that everyone takes, and fell in love. It was the perfect combination of language, psychology, and science.
That is amazing. It's interesting because it is rare that I find someone who's like, I knew from, whatever age that I wanted to be a speech therapist. It's like you find the major or it finds
Mhm,
you. Even my
mhm.
mentor and my line sister, she was on a college tour and got mixed up. She was supposed to be going with, I think, like maybe the accounting majors or somebody else. And when she arrived, they were like, well, where are you supposed to be? And she was like, I don't know. And they were like, okay, well, just join this group. And it was the speech group. And that's how
Ah,
she found it and fell in love with it.
wow. Yeah, no, yeah, so many, and even like when we get applications, most people have like a family member, like a sibling, a parent, or somebody that had to work with the SLP, and that's how they found the profession. I mentored a young lady who knew in middle school that that's what she wanted to do. And she just this year, she was in her first year in an undergrad program, so she followed through, but that's probably the youngest person I've met that's like, yeah, I want to be a speech language pathologist.
Did she like have speech as a child or know someone who was an SLP?
You know what? I want to say, and I hope I'm saying this right. I want to say her next door neighbor had a child who was seen by an SLP, and I think she got to experience some of that.
Okay.
Hmm.
Yeah. I think it's important for us to try to raise awareness about the field. I know when I was maybe 2 or 3 years in, I started going to like middle schools and high schools because my line
Hmm.
sisters are, in education, counselors. And so when they would have career day, they would, reach out to the other line sisters and say, can you come and speak about your career? And there were so many people who didn't know about speech. And, it's not shocking. I didn't know about speech. I fell into it as well. And, there were the funny part is when I would go to the classrooms and talk about speech. As soon as
Hmm.
I got to the salary portion, the teachers were like writing it down, like speech therapy. You say like what programs? How do you get into it? And so I may have converted some teachers before I converted the students, but I think that it's big that we need to raise awareness about the field as a whole, so that
Yeah.
young people know that there is an option outside of um, what is presented at
Hmm.
career days, etc. So it's important for speech therapists, if you're out there listening, speech therapists, go and volunteer for career days and let other
Yes.
young people know about this field. It's such a great field and so diverse. All right, so I would really like to know, getting back into the brain conversation, could you talk a little bit about your experience with working with people who have had brain injuries and just like the impact that it has on that person as well as their family members?
Oh yeah. So I want to say I had my first real experience during my CF, where I really got to see how it impacted that person, but also like their family as well. I had a young man. Well, at that time, I think he was probably he. I think he was older than me, but he had actually drunken himself into brain injury. So he was drinking a liter of vodka a day. He was
Mm.
depression. He had experienced a really bad divorce. Um, the wife left him for his best friend. Yeah, yeah, it was bad. It was bad. So he was in this place where he was trying to drink his problems away, and it basically damaged his brain, right? And so this man was like 6'3", 6'4", or something like that. So he's this big, long man, and the damage to the brain, it impacts how you communicate, how you think, but it also can impact your motor control. And so his limbs were flailing all over the place. He couldn't control himself from cursing. So he was yelling out curse words just randomly. It didn't mean anything, it wasn't directed at anybody. He just couldn't control it. And he just, for a minute though, he had like signs of dysarthria where like muscle weakness, his speech was slurred, all those kind of things. And then as he's like off of the alcohol, but we're going in and we're doing cognitive therapy. We're doing some motor skill things every day. You
What
start to
setting
see
is this?
it was a skilled nursing. Um, and we had like different levels. So like the top floor was rehab. That's where he was. And he just, as we started working more and he started kind of coming more to himself and recognizing things, you got to like understand who he was as a person, not just this man that came in who was cussing and couldn't communicate well. And you got to see who he was, but also his father and mother were really, really the ones that were like caring for him at this time. And the way that they were coming in and visiting and participating in therapy, it was like that was like the moment for me where I really realized like what all we do that helps them outside of the space that we were working in. Um, and then just sometimes just seeing how the person has such a hard time with things that typically would be easy, right? And then you get to help them get back to this place. I think that's really where I started to see those things. And I think what else did you ask me? How it impacts them, how it impacts the family.
Yeah.
But yeah, it and with the family, really like we have to pull them in. We can't just do the therapy and then think they're going to go home and things are going to be okay, because they're always going to need some level of support. And family members don't all they know that something happened, right? But particularly with brain injury, if that skull and everything wasn't cut into and the person just looks like us, they start thinking they know what they're supposed to be doing. They know what they're saying. They're just being annoying right now. They're just being a jerk. And so we have to be the ones to really work with them so that they don't become so frustrated. Because when one person in the family experiences a brain injury, the entire family basically is experiencing that brain injury.
Absolutely. I have spent many a session providing education
Mm.
to spouses and children on communication and patience. I've even had spouses to say, like, it's been a year, like, she should be, fine by now. And while, you have to be understanding for the family member, your focus and priority is the patient and
Mhm.
helping to find a balance in that. And something
Mhm.
I think about with brain injury is how much we take for granted. Like we have, I will say, the privilege of working with and treating people who have brain injuries so we can see how important it is and things that we may take for granted. But the thing that I like that zooms into my mind when I think about how we take it for granted is this might not be great, but texting and driving.
Mhm.
Because you think about how many different, you know, how much brain power that takes. And you, especially when you've worked with someone who it's like you can
Mhm.
spend an entire session on elevating a tongue tip to reach, the lip or, their teeth or something like that to produce a sound like, oh. And it's
Mhm.
like, here we are texting, scheduling something, talking on the phone, paying attention to the exit that's coming up. And it's like so
Yeah.
many different processes are working. And it's no big deal for those who can multitask. But I think about,
Mhm.
man, like this would be an impossibility for some people depending upon where they are in their journey.
Yeah, and the thing about that, I'm glad you said that because it takes away their independence, right? And that's usually the biggest thing that really impacts them because we know with brain injury, you're gonna always see some level of depression that comes. It could be chemical imbalance, but also the realization that, man, just last week I could drive, I could text and drive even if I'm not supposed to, and do all these things, right? And now I need help with everything, or I can't remember, I can't do these things on my own. And it can just really take a person to another place. But you know what I also say about family members? One of the one of the stories I love to tell in class, because I always talk about the importance of support groups. And I used to lead a support group, and it was all people with actually I think this they were all aphasia, they were all a stroke, brain injury from stroke, but almost all of them had spouses there, right? And so we got to do a lot of that kind of teaching on both sides. But also, there was this one particular couple that the husband, the husband was injured. He could not communicate well. He really couldn't do a lot of things. And the wife was like, well, yeah, we used to go traveling until the injury. And we used to do this before the injury happened. And these are some things we used to do. And that's exactly how she was talking, right? And everybody was like, the same face you making. Everybody was like, and the students would come to me and they were like, Dr. Davis, he's so mad, so angry, da da da. And then even one of the other supervisors was working with them, and she was just like, that lady. And I said, well, okay, next time they come in, have her come in my office and I'm going to chat with her a little bit. So they come in, the husband goes in with the other supervisor and the student. The wife comes in my office because I think I did their eval, right? So she knew who I was. And so I was like, hey, I said, I just wanted to chat with you a little bit. And I just wanted to know, like, how you doing? Instantly, that woman started pouring crying. Tears were just running down her face. And I just let her have the moment. And she was like, no one has asked me that in a year. And I was like, okay. So I was like, tell me what you're feeling. And she was like, he did everything before the injury. He paid the bills, he took care of all the house stuff. I was a teacher, I was retired, and now I have to take care of him and everything in the house. And nobody knows what that feels like. Right. And so that it was like a moment where it was like, yeah, she was grieving. She had to grieve who he was, right? And then she had to come with the fact that she now had to take on all this extra burden that she hadn't had to do for so many years. And so we ended up like doing like separate sessions, and I brought in one of my mentors who was like a caregiver guru, and after that, her whole demeanor changed because she just needed to get it out, and she needed to know that she wasn't the only person who was experiencing those kind of feelings because people don't like to admit that they feel some kind of way.
That is a tale as old as time, as time in this space. But for
Mhm.
those of you who are listening who are clinicians or students, make sure that you check in with the caregivers as well, especially spouses, kids. Um, and this was something that was said to me in grad school, which stuck with me, which is you are essentially being inserted into someone else's crisis because
Mhm.
otherwise they wouldn't need us, especially on that medical side.
Yeah.
So you want to take that into account because what, you were just describing was really frustration,
Mhm.
grief, probably feeling loss, resentment, and all of that comes out in what sounds like a snarky comment, but you took that time to ask, "How are you?" And I will say there have been occasions where I ask a caregiver, "No, how are you?" And the societal response is, I'm fine, I'm good, how are you? But
Mhm.
when I pause and I look them in the eye and I say, no, how are you really? There can be tears because, like you said, nobody asks them and everything shifts to be about the patient. And yes, our sessions are about the patient, but checking in on that caregiver, counts as care as well because how they feel, whatever's pent up, etc., that can come out on the patient. I've been in
Mhm.
a hallway and seen, a daughter yelling and screaming in a patient's face who's in a wheelchair. And, there are two sides to that story. No, she should not have been, screaming in his face like that. But that is tied to depression or neglect, or, a lot of patients can say, or patients' caregivers can say, like, their marriage is in trouble because of, how that shift has taken hold of their lives,
Mhm.
issues with their kids, etc. So thank
Yeah.
you for sharing that story. That is something important to consider. Caregivers, absolutely. I want to take it on back. You mentioned the patient that was dealing with the alcohol abuse.
Mhm.
And that made me think I can get another brain expert's opinion, because I definitely have my own, on the Wendy Williams situation. So
Oh.
there's been, speculation that her cognitive decline is solely due to alcohol, and that dementia is not a possibility, that she's fine. She should be able to work and be on her own. And now, the conservatorship has been modified, I will say. But I would love to know your thoughts on how people are commenting on what's going on with her.
Oh gosh. I haven't looked at that information in a while. Um, so I think that I think that when it comes to like family members and publicists, they're always gonna say, "No, it's not dementia. No, it's not brain injury. Oh no, this wasn't a stroke." I think that sometimes, and there can be denial too, right? Because when you see someone kind of seem like they're falling or hitting rock bottom, and then you start to see them improving, um, it, it could be connections to the alcohol because alcohol does cause issues, right? And if it is a chronic issue, there is a form of dementia that's related to, chronic substance abuse. Typically we think about, it's called Korsakoff's. I don't know if the primary progressive aphasia, because I think that's what they were saying Wendy Williams has, right?
Yeah,
But not,
frontotemporal and primary progressive
but
aphasia.
it's possible. I don't know if we researched it enough to really know. Um, and then it could have been um, that she was kind of had a predisposition for it anyway, and the alcohol just exacerbated what was going on. That could be a factor. Um, I mean, it does seem like, I think the last time I saw any like footage of her, it seemed like she was in a better space than like when that documentary came out. But it could be that she's not having the thing that maybe makes things worse. I think I don't know.
Well, I'll share my opinion and then we can chat about it.
Okay.
I wholeheartedly believe that she has some form of dementia.
Mhm.
Now, like you said, it could be that she was predisposed to it from genetics. It could have been her, this is well documented. She spoke about it herself, her drug use, and then her abusing alcohol. So
Mhm.
I think any of those three factors could play a role. It could be all of them, but I definitely think she has some form of dementia, absolutely. And I can't speak to the primary progressive aphasia because when, she's communicating on camera or, on podcasts, she seems to have her words about her. But I do hear, to me, what sounds like masking. And I think that she has used her family, like her niece,
Mhm.
to help with make it to help her present as if she does not have dementia. But I do think it takes someone with a professional ear like ours to be able to identify and say, no, there is still something that's going on. But I think people have a difficult understanding of what um, incapacitated is,
Hmm.
because they're like, oh, no, she's not incapacitated. Like, she's fine. She's fine. She's fine. It's like you
Yeah.
can hold a conversation and still be incapacitated.
Yeah. And and I think because I do agree with you on that. I do think that there is some form of dementia. I don't necessarily know if the alcohol is the exact cause because she had a life. She had a life, things going on. But also I think that most people, when people think about dementia, they mostly think about Alzheimer's. And there are different forms of dementia. Alzheimer's develops from like a plaque that kind of like eats through the brain in a sense. That might be a harsh way of saying that, but it is. And then when we talk about frontotemporal, like the atrophy of white matter that could be happening, that's a whole different type of dementia. I think that time will tell also, and there are factors, right? Like the DSM-5 says that the person, and I might I'll say this correctly too, you have to show some signs of memory loss in conjunction with other factors that are related to your activities of daily living, for it to be dementia. But depending on the type, it could be a super super slow process. The progression could be very slow. So it could, sometimes she could seem like she's totally with it, and then sometimes she could have some challenges. So,
Yes, and I agree that when you said that alcohol could exacerbate, I think that when we were seeing her on that documentary or docu-series on Lifetime, if you haven't checked it out and you're interested, please feel free. I think that she was really drinking a lot of alcohol at that time, which really exacerbated how she was presenting. And so
mhm,
now that I don't know if they've completely removed it, but she seems to be doing a lot better because that factor has been removed. But I still think that there's something underlying that's going on that non-professionals would not pick up on.
mhm,
Hey, for all of my speech therapists and other healthcare providers, let's be honest, writing soap notes can be time consuming and exhausting. But with Freed AI Scribe, documentation just got a whole lot easier. Here's how it works. Freed AI uses artificial intelligence to record your sessions and instantly generate accurate professional soap notes. That means more time to focus on your clients and less time stuck doing paperwork. Freed AI is HIPAA compliant, which made it easy to incorporate into my private practice. And it has been a game changer. It saves me time, reduces stress, and best of all, helped me finally get out of the office at a decent hour. If you're ready to simplify your documentation, use my code Dr. Kelly50 for $50 off your first month's subscription. And join me and other SLPs who've made the switch to simplify your soap notes. The link and discount code are in the show notes. Now, back to the episode.
Yeah. Well, thank you for sharing your thoughts on that. I would like to dive into what you see or what you think is misunderstood about brain injury.
mm. So, if we're talking about mild brain injury and concussion, I, it's so many things. Okay, where I want to start with this one. Um, I definitely think that there is misconception about whether concussions are real still, particularly in the sports world. I definitely think there's some misconceptions about that. I think that most people really don't know what it looks like post injury. I think that the physical symptoms are the most common, and that's what people know because they feel it and people talk about it. But those changes that happen behavior, personality wise, and cognitive wise, there's still a lot when it comes to that. And so, with this population, we also see that it's really hard for them to maintain relationships. And so it's hard for them to keep a job, right? Because people don't understand what's going on with them. They usually label them as, oh, this person is annoying, this person is rude. They just say whatever's on their mind. They keep forgetting things. And so I really, really think the symptoms that are not so apparent and that people haven't heard about the most, I think that's one of the biggest things. And it's also the most unfortunate because that's how those individuals end up living in these kind of isolated lives too and not feeling supported.
Which goes back to you speaking about how important support groups are, not just for patients, but
Mhm,
also for caregivers. And you also mentioning earlier about how people can look fine. I think that's a really huge
mhm,
misunderstanding in this space is if you don't have, a bandage wrapped around your head or something on your forehead that says brain injury, and we know that doesn't happen, society looks at people like, oh, well, you should be fine because you look normal. And I talk about this in my talks and when I speak with students, a cast, a wheelchair, a crutch, a sling, those are all visual cues to society to help people be more patient, have an understanding, and kind of think like, oh, well, something's going on with them. So, let me
mhm,
carry your books. I can hold the door for you. How can I help you? But when you don't have that and the injury is invisible, then I think that patience and consideration is not there for the patient. And I think that
mhm,
also aids with depression and, self-harm and not wanting to continue because things seem so hard because there aren't those allowances for patient or consideration. And so when I
yeah,
talk to people, I want them to have a change in their mindset, like reframe some things. Like you could see somebody who's, road rage or wasn't polite to you in line, and instead of taking it to heart and being defensive about it, maybe consider maybe something's going on with their brain.
mhm, mhm, mhm. That's usually my first go-to. I think
Same.
it creates a lot of empathy, right? Like if let's think about that. If you run into somebody who is just completely nasty, right? And you could let them ruin your day, but if you go, huh, this person might have brain injury. I'm gonna be a little softer. I'm gonna give them a little grace right now. It might
Exactly.
actually make a lot of people's days go a lot better. And not to poke fun, but um, at the end of the day, we really don't know what people have going on. And I think we have a special set of skills where we can listen to conversation and watch behaviors and say, "Oh, I think there's something there, right?" And for some of these people, some of them were like this before they experience injury too. But everybody needs a little grace and empathy. So,
And some people, they just may be unpleasant people. But like you said, they may have been unpleasant before the brain injury and that exacerbated it. And it also could be that they do have something going on with their brain. And again, there's no sling, there's no tattoo that says, brain injury. But, in speaking with a sports space, I find it that when people have that like you look normal so you should be normal kind of a thing, I like to think about, everybody talks about, well, it's one in a million to make it to the league, any league, the NFL, NBA, MLB, hockey, just soccer, any league, it's one in a million to become a professional athlete. And I often ask the question, what about the other million
mhm,
that are out here without a visual cue that they've taken repeated injuries to the head,
mhm,
repeated concussions, and then they don't make it to the league because they're part of the million that didn't. And then it's like, well, what do? They are
mhm,
our Uber drivers and our accountants and our lawyers and our cashiers and, bank managers. And so those interactions, it doesn't matter the setting.
Mm-hmm.
We are in a silent epidemic. So there are a lot of people who are experiencing concussion and either haven't reported it, don't know that there is help or how to get help, or that they need help. And so I think about the other million quite often, and they're out here, which is why we should be giving them grace,
Mm-hmm.
and a little bit of wiggle room and patience because they could have something absolutely going on with their brain.
Yeah, very true. Mhm.
Okay, so you are the chair at Howard, which is, I like to say, like the Black Harvard. Like there is a set of HBCUs that I believe, we have our own Ivy League. But I would love to know, how do you balance it all? We talk about mental health, of course, that is related in the brain health space. But how do you balance researcher, educator, clinician, chair, baker? Like you're doing a lot of things and doing it well.
Oh, Kelly. Now, I'm gonna see if I can figure out how to answer this question. Um, I don't know if balance is the right word because the scale is always tipped.
Juggle?
It probably is more of a juggling act. There was a session that was supposed to be on life work balance, and the facilitator actually used the terms achievement and enjoyment. So you go through these moments of you're achieving, you're achieving, you're achieving, but you have to schedule in the moments for enjoyment. Um, I think right now I'm on an achieve. And I'm waiting for summertime so that I can take a vacation. Okay.
Time for the enjoyment.
Um, now, I use my calendars heavily. So I use my Google Calendar plus my work calendar, because that one will show up in my emails. And then I have my written planner. A lot of prioritizing what the most important things are. But the other thing that I had to start doing was waking up earlier. Because before I became chair, I didn't have to go to work early. I didn't have to go every single day in the office. And so I could kind of like, I didn't have class till 4. I could roll on campus at like 1 o'clock, depending on what my office hours were. But now I have to be there, most of the week, most of the day. And I found that if I get up early in the morning, I can do like my devotional prayer time, but I also can like get to like the small things that are on my list, that like the emails, the reviewing a paper or something like that. I also will bake early in the morning. So I'll get up at like 6 o'clock or maybe 5:30 in the morning, and I will bake whatever I need to for whatever event or order. And I find that when I do that, I tend to be able to kind of stay more so on track. But I'm not gonna lie, it gets wild. Sometimes it feels like I'm on this roller coaster, but I'm on like the down part, like where you just just zooming, it gets to be a lot. But I keep the baking because the baking is what helps me stay sane from the full-time job, right? Because being in an administrative position, it's a lot of one is a lot of paperwork, it's a lot of emails, but it's also a lot of like dealing with people in different ways that you didn't have to before. And so even though baking sometimes I don't always feel like it, I know that it's the thing that keeps me kind of zen. And even the podcasting, I love it so much. So having those things help me to, even if I feel kind of tired and overwhelmed, it helps me to not feel like I'm just falling apart.
Well, that sounds like you have a nice mix of compensatory strategies. I'm in here looking at it like a therapist. She's got her calendars. And then you have a written component too. You write things down. Is that in a notebook?
Yeah, I have I think it's like a Clever Fox. planner, the one that I can put like the month and what I need to do during the day. So that one allows me to write out the actual task that I need to do that week, like what's really important that week. It has like a section for priorities, and then I can write out like who I need to email for the day, what kind of meetings I might have, what kind of space. So yeah, it sounds like a lot, but the ones that are on the email and the phone, I like those because they give me the ding reminder, the notifications. But the written one, I can look at it and I can kind of play around with, oh, okay, I did task 1, 2, and 3. I can do 4 and 5 tomorrow.
And that is important, being
Mm.
okay to push some things to the next day in the
Yeah.
name of peace and
It
brain health.
is. It is. I think that that's why sometimes we get overwhelmed because there are a lot of things. Because it's a lot. All of us are really doing a lot. I know you are too. I've fussed at you about sleeping many
I
times,
know. I'm doing better, ladies and gentlemen. I'm trying to do better.
but when you don't sort it out, right? Or if you feel like if you think everything is important right now, then that can be overwhelming. But when you look back and you go, oh, you know what? I could do this next week. It takes the load off of you.
What helps you get to that point? Because sometimes I'll have to do self-talk because, of course, when the to-do list is long, you want to get as much done as possible. But I will
Mhm,
have to like stop myself and say, at the end, like at the end of the day, this is a report and you can do it
mhm,
tomorrow and you don't have to
mhm.
be in here till 2 or 3 in the morning. You can get some rest, get yourself some food, come back, recharge, and do it the next day. How do you get to that point of it can happen tomorrow or next week?
You know what? I think it's the same thing. And then also like when I realized that I was like really becoming very overwhelmed, I started like reading different kind of books that talked about those things like the boundaries and, organizing your life and making sure that you're putting your mental health first. And a lot of those things talk about recognizing what's most important and what's something that can wait. And so now I can like sit down and say, okay, you feeling overwhelmed, but let's write out that priority list and let's see what the due dates are. Okay. Yeah, I could do that tomorrow. And then sometimes it probably is missing a due date. But
It happens.
sometimes you just have to. And I've also learned to be okay with saying to somebody, hey, I need a little extra time. Because I think sometimes we want to seem like we're doing really well and that we can do it all. And we don't ask for the extra time. And we're either stressed out or maybe we don't do as good of a job because we're rushing. And so I've had to like be like, you know what? Oh, I did say I was going to review this article. Um, and then I'll email the editor and say, "Hey, I really need like 5 more days." And they usually just say, "Okay."
I think that is underrated. Asking for an extension as well as
Mhm.
asking for help. I think that can be difficult, especially for high achievers.
Mm.
But that is definitely underrated. Make sure that you ask for an extension or ask for help if you need it.
Mhm.
Um, Now I would like to roll into, now these are ways for you to balance and or juggle, however you'd like to say it.
Okay.
What do you tell your students? Because, different level of overwhelmingness, but I mean, we all remember those grad school days and what that felt like. So
Mhm.
how do you help your students find that balance, healthy balance?
So now I'll answer this because I do have these conversations. How much of it they use, I'm not exactly sure.
All of it.
Some will come back and say, "You know what? I tried this method and it worked for me." So I give them the same thing. Like I'll ask them, like, "How are you keeping track?" Because I will have them come in and I'll say, "Bring all your stuff and let's sit and look at everything you need to do, and let's figure out how we can help you organize it." And so I'll say, "What are you using right now?" Sometimes they're not using anything. They're just letting Canvas? They're letting Canvas tell them when things are due. Sometimes they have a written planner. Sometimes they're using a calendar. So then we talk about different apps because there are to-do list apps out there. There's homework apps, and they can put in each class and what's due and when it's due, and they can get notifications and all those kind of things. And some of them will have check boxes so you can check things off. And so I'll talk to them about that. I also talk to them about recognizing what the priorities are, what's most important, what's not that important, and then figuring out strategies for doing stuff. Because I think what I'm seeing the most with students is that they don't have they're learn having to learn how to use strategies for completing work, um, like those soap notes and things like that, or treatment plans, right? Learning how to become a good clinician also means learning how to like structure a treatment plan that you can implement over a few sessions instead of having to do something new every single time. And the way that I set up my therapies, like my soap notes are very straightforward, they're very medical based. And so I'm trying to show them how you can reduce some of the stress and time because you don't have to reinvent the wheel over and over and over. We also have a new faculty member who does a lot of work in executive function. And so she did a session with the students on different ways to like organize your time and plan things out. And then I've brought in like a friend of mine to do a workshop and things. So I try to like also bring other people because sometimes outside folks can have more of an impact because they hear me all the time. You
But
know,
they love you.
you can, but you love your mom too, but you don't listen to everything, right? Or your dad,
True.
you don't listen to everything they tell you, but then somebody outside of the house might say something and you're like, oh,
What a good idea.
yeah. So I try to give them some of the same tools, but I also try to help them find like what really works for them the most.
Brilliant. What is what is something that you want each of your students, when we talk, I know you call them your babies, what is something that you would like each of your students to take away when they leave Howard, when they leave your
Mm,
program?
mm, mm, mm. So I'll say, I think the things that I talk to them to about the most are one that I teach in class a lot is being more empathetic than sympathetic. So learning how to have compassion without being overly like, I'm so sorry that you had a brain injury, you know, that kind of thing. I I care a lot about their mental health. And so I do talk to them a lot about making sure that you're okay so that you can help other people and that you don't have to be perfect. Um, I think that's the biggest thing because I mean, I see it with a lot of different professions, but because I'm in speech pathology and I know you see it too, there is a very high level of wanting to be perfect. Um, and that's just not realistic. And it leads to a lot of different types of negative self-talk when you are trying to be perfect because you can't be perfect. Um, and just having an open space for growth. And so what I hope is when they leave, that they leave with an open mind to be continuous learners, and to know that you're gonna get it. You just don't have to get it all right now. And I think, but there's probably a whole lot more I could say, but I would say those are probably some of the main things. Um, and also, I think another thing is not rushing your life. Because speech pathology, we know it's a lot of women, and a lot of things I hear is every year there's somebody who they feel like their life should have been at a different place at this age, or they want to rush through the program and they want to get this and they want to do all the things right now. And I'm like, you don't have to do everything right now. Your life is going to be long. I mean, I know we don't know how long we have, but if you're super stressed out, you got to take your time and pace yourself because opportunities are always going to come. Like it's so many things that I do now that I never would have even thought back in my 20s and 30s, right? You know, at that time you're like, "Oh no, I got to get a career. I need to be married. I need to have kids. I need to do I need to do these things." And actually I didn't need to do all those things by that certain age, right? And I'm still experiencing new things and new opportunities. And so I don't know, I probably gave you about 5 things, but
All great things. These are things I hope that listeners who are students or even who are not students take from, because that is all facts. You don't
Mhm.
have to rush. You don't have to be perfect. I mean, that's something me and my therapist are still working on. You don't have to be perfect. You don't have to do it all. And there is time. Like you said, we don't know how much time we all have, but don't, I don't want to say ruin, but don't impact your experience of what you're going through in the moment because you're so
Mhm.
focused on the next thing. Like be present. And that's, I'm doing my
Mhm.
best to get back into my yoga space. But I
Mhm.
was doing a session a couple days ago, and it was so it was such a small statement that the person who was leading it said, but it was just like be present. Feel where you are, be in your body, be in that space. And to rush and think about to-do lists and productivity and what needs to get done and presentations coming up and classes and grades and like uh placements, clinic placements. Just be still for a moment and
Mhm.
remember those remember who you are, be rooted and grounded in where you are and just feel that moment. Like that's allowed, that's okay. And I think
Mhm.
just taking a breath sometimes during the day, I'll say that in sessions with
Mhm.
patients, like breathe. Take a
Mhm.
moment to breathe.
Yeah.
So five or however many gems you just dropped, those are all valid. So please, listeners, take heed. We have a brilliant doctor sharing some things that can absolutely help. So those are great takeaways, and I'm sure that your students take that and more when they graduate from your fabulous program.
I sure hope so. Oh, can I say one more thing
Of
specific
course.
to speech language pathology?
Yes.
For those who are in grad programs, knowing that your program will shape you. It's designed to do that, but it does not predict the trajectory of your career. Because just because you only get these kinds of certain experiences in your program, it does not predict what's going to happen when you leave. Because you know that happens too. Like I got so many school placements and I didn't get medical. There are so many SLPs who started out school SLPs and then they transition themselves into being medical. I get emails from former students all the time that are like, "Yeah, I'm transitioning to medical. I've been working in the schools." And so just knowing that you can be whatever you want to be.
I like that. And don't put yourself in a box. And
Mhm.
also, like you said this, I think earlier, never say never, because
Mhm.
well, I knew I was not going to work with kids. I did know that. But when I was in grad school, the program brought in a private practice owner. And I was like, well, no, I don't want to do that. I know I don't. I just want to work for someone, make my little money, and
Mhm.
enjoy life. And here I am, a whole private practice owner. I never thought I'd be in academia. I teach. Never thought I'd have a nonprofit. Those things just weren't of interest to me at the time. But
Mhm.
as you grow, graduate, have your experiences in different settings with different patients, you just never know. The world is your oyster, and that's the beautiful part about this field and this degree is how versatile it is. You could start off in schools and end up the director of rehab at some hospital for all you know. You just never know.
Mhm. Yeah, I think 85 to 90% of the things I'm doing right now, I said I would not do.
Exactly. That's a good percentage, probably the same. I mean, I knew I'd be with adults, but I private practice, academia,
Mhm.
nonprofit,
Yeah,
podcast. I just never thought those things for myself.
all the way.
But and also lean into, I feel like we're giving plenty of advice here. Lean into what someone else may see for you that's positive.
Mhm.
Because I've encouraged people have encouraged and poured into
Mhm.
me to
Mhm.
do things and take steps and leaps that I was either too afraid to or thought that I wasn't appropriate for. And it just opens up the world for you even more.
Yeah, helps you grow.
Absolutely. I like to use the peephole analogy. Like you
Mhm.
can peek outside and for someone who doesn't have experiences or is afraid of those experiences or doesn't want to try new things, they get that one view of the peephole. But the more you grow and expand and try new things, that peephole gets larger and then you can stick your head through it and you can see, oh, look, like there's way more
Mhm.
sky and there's, more houses up the street and there are people, doing different things and you just have this exposure to more the more that you have open mind and experience. So I am certain that your Howard graduates experience things like that in your program and then afterwards. I think it's such a testament to how great you are when you get those emails reaching back out.
Hey, everybody, Dr. Kelly here. I have a quick question for all of my fellow speech language pathologists. Are you on the hunt for fun, functional, and diverse therapy materials for both your pediatric and adult clients? Well, let me put you on to something I absolutely love and use in my private practice: Cognishine. If you haven't heard of it yet, Cognishine is a digital platform designed to support speech, language, memory, attention, executive function, and more. It's science backed, clinically effective, and works beautifully for both teletherapy and in person sessions. But what really makes Cognishine shine? It's completely customizable. You can tailor exercises to your client's specific needs, whether you're targeting speech sounds, supporting recovery after a concussion, or strengthening cognitive skills post stroke. It's become a game changer in my sessions, and my clients absolutely love it. So, if you're looking for a tool to elevate your therapy, check out Cognishine and tell them Dr. Kelly sent you.
Thank you.
Of course. Okay, this is the part of the podcast where I like to do the candid questionnaire. So
Oh
I'm going
boy.
to ask you 5 questions just to help our listeners get to know you a little bit better. Okay?
Okay.
All right. First question. What's one word your friends would use to describe you?
Mm. Just one. I can only give one. I
Just
can only.
one. I'll give you two because I love you so much.
Oh, because I think the one I hear the most is sweet. Um,
Agreed.
I get that a lot. Um, and the one I gave myself,
Okay.
I think comforter.
Comforter. Okay, yeah, I
Mhm.
can see both.
Mhm.
Definitely. Heavy on the sweet. Yes. Comforter, yes. Yeah, if you haven't been in the good graces of Dr. Davis, there is just a calmness that you emit that helps with that comforting, I think. Yeah. Yeah. Okay, second question. If you could instantly master any sport or physical skill, what would
Mm,
it be and why?
a physical skill. That's a good one. Because I tried to play basketball when I was in school, and it was a very embarrassing experience.
Tell the people how tall you are, Dr. Davis.
I am 5'2". Yeah, I didn't even make the C team. Okay.
Oh my gosh. Oh my gosh. That is a hilarious story. Yes, ladies and gentlemen, she is sweet and 5'2" and was ready to be a basketball star out in these courts, honey.
There. But I guess if I could master a skill, a physical skill, what would I want to do? Actually, I think it probably would be basketball. I would
Okay.
love to be able to like kill on the court.
Okay, all right. I think that would be um a sight to see. But I for my own purposes, I'm envisioning you with your glasses on, and I'm envisioning you
I
like
did have glasses on then. I was in the fifth grade. I hadn't got contacts yet.
I could just imagine you dribbling the ball and passing it between your legs and layups.
Oh, yeah. I was the one who like ran all the way to like the wrong end of the court. And in my mind, I was dribbling, I was going down. But what happened in real life is I was just holding on to the ball. I
Not like that. She's hugging the ball. Are you hugging the ball?
shot. It didn't make it. And it was the wrong. Horrible. Horrible.
Oh
I know my
man.
daddy was like,
But he was in the stands. He was
he was
showing his
there.
support for his baby.
My aunt would come to the house and try to coach me, and just didn't go well.
Well, if the genie comes, we know you will be seeking that WNBA skill set. Yes, what? Okay. Number three. What's one activity or hobby you find most relaxing or beneficial for your brain?
Ooh. Um, so I love crafting. I mean, baking is a given, but I love crafting.
What
I
kinds of
love
things?
so with my baking, sometimes I get to decorate cakes, but I also like when I do the small ones, I will decorate the boxes. And I love to do like wax seals. I'll hand make bows and put little medallions on them. I like to get the terracotta pots and paint them different to match whatever room the pot is going to be in. So yeah, I love crafting. It just
You're a creative.
Yep.
Yeah.
And I had to learn that again because I
How?
did it a lot as a child, but I had stopped for a long time because school, right? It was like, oh, school, that's all I can do right now. I don't have time. But whenever I get myself to sit down and do those things, I'm in like the best space. And I'll do it. I'll stay up all night to like craft.
See, I am not a creative. People will say like, "Oh, yes, you are." I just feel very A type. Like I'm not a creative. I'm not in that space. And the most you will get out of me are paint by numbers. Like those wine and sip things. During COVID, I invited some of my line sisters over and we did um paint by numbers. And even
Mhm.
that, like I was very like strategic with it and I didn't want to get outside the lines. But like I feel more artistic, creative people are like, let's just see where the paint goes and it's okay. And I'm like, no, it's got to be in the lines.
But you know what? I'm like that too. So I love to craft, but I do like for things to be quite on point. So I'm gonna stay in those lines. Every once in a while I'll let myself go out. Every once in a while. But
You don't
I'm
get the
I'm
tissue
kind
to
of like
try
that.
to.
It depends on what it is. It depends on what it is. But yeah, for the most part, I'd like things to be centered and
Organized crafting.
organized
Well, then
crafting.
I can probably get on board with that.
Mhm, mhm.
Let's see what's next. I love this one. What's the weirdest or most unexpected item in your bag or car right now? You're laughing.
Okay. It- I'll go with my car. Let me think. Because I got some stuff in my back seat that's supposed to go in my office. Let me think what's in there. Uh, unexpected or weird. Do I have anything weird? I think I may have a mold of a brain. In the back
Well,
seat. Um, it's a little one.
change the fact that you have a molded brain in the back seat.
If somebody broke in, they might be like,
So leave
they
that.
might think I'm a teacher.
Well, I think that that would be something they would leave behind. I don't think it unless it was someone like me who's like, "Ooh, score."
It'll be on the street in the place where my car was.
Leave the little brain. Well, that
Yeah.
would be the cerebellum, but here I am nerding out. Well, now I'm excited. I love the brain as well. So I'm like, well, what kind of brain? Does it have color to it? Can you split it apart and see the different like lobes? And we don't have to get into all of that. I'm just nerding out right now. But I love that as an unexpected item. Okay, last question. What's your go-to guilty pleasure TV show, movie, or song?
Oh, let's see. So I used to go to the movies once a week. Uh,
Really?
hmm Pre-pandemic, I went
Ah,
once a week. That was like my treat to myself. Um, Sometimes I go with somebody else. Most of the time I went by myself. I think because I don't watch TV that much. If I do turn on TV, I'm probably like finding like a home decorative show because I'm probably doing something else at the same time. So I would probably say the movies. And I'm a bougie movie goer because I like to go to the ones that serve you meals. Um, and so I will plan out like, okay, I know I'm gonna get this and I'm gonna order that and I'm gonna watch this movie. And that's my thing.
so where do you go for this elaborate movie? Is that a Virginia treat, a Maryland treat? Do they have them in the district?
Yeah, yeah, there's one in DC. There's a Alamo Draft House.
Ooh.
And it's nice because I think they have like a little bar or something like that if you come early or something. Because I think we have some of those back home. Like back home, we have Studio Movie Grill. I don't think I've seen those like right in the DMV. They might be further out. But yeah, those are my favorite because and they have the good reclining seats. Like I'm there. I got my little either a little nice sweater or a little tiny blanket I could put in a purse.
You get it together. Okay, that sounds like a really good
Love a
movie
movie.
experience.
And
Okay, so go
oh, go
ahead.
ahead. I am one of those people who talk during the movie, which is also why I go by myself a lot.
So are you talking whether someone is there or not? Like, are
Yeah,
you talking to the screen? Oh my God.
I'm not super loud, right? But I'm like, ooh, no. But I don't watch scary movies. But like, I love a good action film, and I'll be like, oh no, Tara, look, oh,
They're
I know
coming.
they're gonna. I was just telling my students we were talking about sports concussion on Monday, and I was like, my brother went with me to see the movie Concussion. When we left that movie, he was like, I am never going to see a movie like that with you again. Because I was like, well, you know what? This is actually quite accurate because Dr. Amalu really did those things. They embellished a little bit. What they said about brain injury right there, like I
Well,
don't usually talk to the other person that much, but I'm gonna make some comments.
well, I feel you and I would have just been talking through the whole thing. Concussion. That came out in 2015. Oh my gosh, that movie's 10 years old.
Yeah, yep.
Oh my goodness. Still go and watch it, ladies and gentlemen. It's a great
Mhm.
resource. But yeah, I probably would have been right there with you talking. But that is hilarious. You talk to the screen. Okay. So when you say you go to the movie theaters that serve you, is it you can order it and then grab it and go, or do they actually like come and bring your food to your seat?
Yeah, they come like a restaurant. They come take your order, and then they bring it to you. Then they come get it before the movie's over.
I have experienced that a couple of times and I am for it. It is definitely an experience if you have not experienced it.
Yeah. I mean, now, and I am okay to. and I guess I shouldn't say I'm too bougie. I go to theaters where
You
you
didn't
can,
say too bougie. You just said you were a bougie movie theater goer.
yes, where you can get a good bucket of popcorn because I do love some popcorn. So I'll do that too. But now, right now, I like going where I can get the meal.
Yeah. It makes me want to go. Mm. But there's
Mhm.
but I'm so concerned about like COVID, and I know people say like, "Oh, COVID has passed." But I'm concerned about being in the theater and,
Mhm.
someone coughing in my space in my popcorn.
Well, the chairs are so big too, you're not that close to the next person. So those aren't really the ones like if you're going on a date, you're not finna be doing a lot of cuddling
It's
in those
recliner
seats.
style.
Yeah.
Yeah.
And I usually get book my seat on the end.
Smart. Then you don't have
Mhm.
to pass through. That's a
Yeah,
good
and I try
idea.
not to go during like the busy times. I'll go earlier in the day or something like that.
Matinees.
Mhm.
Smart. All
Mhm.
right, maybe I could brave a theater if I have those stipulations.
You could always bring a little bottle of little can of Lysol and
Ooh, that's good too. Don't give me these ideas, Dr. Davis. I'll be spraying and masked up in the theater. Um, okay, so wrapping up, I want to make sure that people know how to find you. Where can people find you? Where can they find your cakes? What do you have coming up that you want people to know about?
Ooh, okay. So I'll start with the neuro stuff. On Instagram, I am overall neuro underscore Dr. D. I'm also that on like Facebook and TikTok, but I don't use those as much. So it'll be old posts. Um, and I do have a website, overall neuro rehab.com, if you are looking for services. And I'll let you know if I can take anybody with my need for balance. The podcast is life.language.lyrics on Instagram, but on YouTube it's just Life Language Lyrics with Laina. And then the cakes are Southern Spice Cakes and Sweets, and it's Southern Spice Cakes across social media. So Instagram, actually, I think it's just Instagram right now. And the website is southernspicecakes.com. Let me see, what do I have coming up? Um, Neuro wise, not too much.
Chicago.
I have some, oh, Chicago, yes. Dr. Kelly will be there as well. We are both presenting at the Black Student Athlete Summit, which is very exciting. It's a great space, especially if you are interested in the sports world. Um, Let me see. I do have like some courses. If you go into my website, you can get into some of my workshops. And podcast comes out twice a month. Typically the second and fourth Thursdays. There's one that focuses on passion and purpose, and then the other one is the Neuro News edition, where I give these brain injury chronicles. And then the cakes, if you're in the DC area, every fourth Saturday, I am at the Jericho Market, DC Creative Institute from 11 to 5.
Check out the balance or juggling act. So many things, but all good things. It's wonderful
Yeah.
how you pour into the community and how all these things are serving and for other people. But I also like that, the things that you do also serve yourself and how you love your baking. And
Yeah.
I believe you share my passion for the brain, which is why we get along so well, I think, amongst other things. But just thank you so much for coming and sharing your light and your spirit and talking to the people with me.
Well, thank you, Dr. Kelly. This was a great time.
We always have a great time, and I have to
Yay.
say we did a really good job because our conversations are usually literally 6 to 8 hours long. So
Who
we
has
had
that
to set
much
a
to
real
talk about?
time limit. Say it again.
Who has that much to talk about? We do.
We do. And when do we find the time? Like we actually schedule and chisel out time because we know it's going to be a while. So we'll either hop on a video chat or a phone call or a um, Zoom and end up
Mhm.
talking for hours and hours. But that's just how sweet and how wonderful you are. I just love being around you and chatting with you. You're such a wonderful person.
Well, same. And I'd like to say too that just in this short time that I've known you, just seeing all the things that you're doing, your nonprofit, the speaking, the awareness, you're doing a lot of great things.
Well, thank you very much. I think you would agree that it is God guiding and making sure that all this is happening. Because some of these ideas, I'm just like, okay, if this is what you want me to do, then I will oblige. But having people like you in my corner has really helped propel and keep me going. Because I'll call, and if I have any kind of question or any kind of doubt, like you're just always there with positive vibes and motivational things. So thank you for being a part of my circle and helping me to keep going.
Well, same. Thank you too. It's been a great time getting to know you.
Yeah, and more to come. I can't wait for May. That's when the Black Student Athlete Summit will be, which you introduced me to. See, it constantly elevating me and people in your circle, in your space. So we will definitely have something on Instagram about our time up there, as well as Patreon. If you all haven't joined, make sure you join for the behind the scenes stuff, goodies. But yeah, that's going to be a good time. Chicago.
Hmm. Oh
Yes,
yeah,
hopefully it'll be warm enough.
I sure hope so.
Yeah, me too. Me too. Well, all right, we'll go ahead and wrap it up. Thank you again. And thank you all for joining me for another candid conversation with Dr. Kelly.
Thank you so much for tuning in to this episode of Candid Conversations with Dr. Kelly. I appreciate you being part of this journey and these powerful conversations around brain health and beyond. If you're loving the podcast and want even more bonus episodes, exclusive Q&As, stories from my professional and personal life, behind the scenes moments, and yes, those bloopers you all love, then I invite you to join my Patreon family, where we always keep it candid. Your membership gives you access to all that bonus content and helps keep this podcast going strong. Plus, every contribution helps support our mission to raise awareness, educate, and empower others about the silent struggles so many face. So head on over to patreon.com/Dr. Kelly to join today. I'd love to have you. Until next time, stay curious, stay compassionate, and as always, keep it candid.